Americans are not eating enough healthy foods to increase their chances of living longer. That's the message of a study by Tufts University, which includes national surveys about people's eating habits. Those surveys found that most Americans did not eat the recommended amounts of good foods, like fruit and vegetables, seafood, whole grains, and nuts and seeds. Nuts, for example, contain healthy fats that can help raise good cholesterol levels. A lack of these foods accelerates cardiometabolic problems, stroke, diabetes, or heart disease, says Noah Mueller, a health researcher at Johns Hopkins University.
Diet does contribute a significant proportion of, does contribute significantly to the overall proportion of cardiometabolic disease deaths. And a significant proportion can be reduced or avoided if we increase our intake of certain food groups, which can fall into a dietary pattern.
And that means eating less of the bad foods, such as processed meat, red meat, sugary drinks, and salty foods. Mueller says eating too much processed meat raises unhealthy cholesterol levels. Sugary drinks may lead to diabetes, while excessive salt increases blood pressure.
The highest proportion of deaths was due to high sodium intake, also high sugar sweetened beverage intake, high intake of processed meats, and low intake of nuts and seeds.
He says people can increase their chances of living longer by eating the right foods.
If we lower our intake of sodium through reduction of processed foods, which contribute about 80% of our sodium intake in the U.S., we can see improvements in cardiometabolic health, including reductions in the number of deaths that are due to cardiometabolic disease.
The study says public health policies targeting unhealthy eating may help prevent some deaths. But ultimately, it's up to people to think about what they put in their mouths. Deborah Block, VOA News, Washington.